Assalamu alaikum, everyone. I welcome everyone today on behalf of Burani Sports. This is Yuosuf Fidaali from Ajman, UAE. And today we have a very interesting personality. We have a doctor who is from US, and we're going to talk about the common types of injuries and how we can prevent those injuries. So it's a personal topic which is very close to my heart because I have been a sports person for the last 30 years. I've been playing cricket, I've been playing football, and I was an athlete in school myself. And obviously, when you're an athlete, when you are a sports person, you are always surrounded by injuries around you. And so this interview is supposed to be very special for me. So the person we are going to interview today, I would like to introduce him. He's an orthopedic surgeon, and he specializes in sports injury, that is shoulder, hip, and knee. And he has been practicing orthopedic for past 6 years in Houston. So please help me welcome Dr. Mufaddal Gomberawala.
Assalamu alaikum, Yuosuf. Thank you very much for having me. It's my honor and pleasure.
Impressive profile, Dr. Saab. Excellent. So I would like to have a lot of questions. I've written it down, and I'm pretty excited to know the answers for that. So let me ask by a very simple question. What are the types of basic injuries what could happen to a person playing sports?
Sure, and that's the most important question. So if you ever want to fix or prevent a problem, first you must define what the problem is. So in sports injuries, if we break it down, injuries of what we call the musculoskeletal system. So the bones, the muscles, the tendons, and the ligaments. As you guys know, the bone is the actual skeleton, and tendons work by the muscle basically goes from bone through a tendon to another bone. So that's how something moves. And the ligaments help to stabilize bones. Different forces go across this area. Normal forces, when you get up, go upstairs, move up and down, those are normal forces. Those forces get multiplied as you're playing sports. So as you start running, sprinting, doing explosive movements, cutting, twisting, getting hit by someone, getting slide tackled by someone, those forces get multiplied. Certain forces and stresses the body can handle, certain forces and stresses the body cannot. And that turns into the most common injuries, which are sprains, strains, or overuse injuries, and then some of the contact injuries where someone actually slide tackles and you have a bone break or something like that. And then we categorize into sort of upper extremity and lower extremity injuries. Basically, arms and legs, categorizing into those injuries.
Okay. And what kind of people, for example, we play cricket very regularly, and we have got around 20 players on the ground. And I've noticed that there are few kind of people who are always, that they're having some kind of injury. Yeah. So my question is, what kind of people are prone to injuries?
It's a very good question. So if someone has had a prior injury in that area, they're always at an unfortunately increased risk of re-injuring that. Before then, there are some genetic predispositions towards developing injuries. Some people may have bone density that is better or worse. Some people may have muscle strength inherently that is better or worse. Tendon or collagen, as in the tendon strength that is better or worse. But beyond that, there's multiple controllable factors. And really it comes down to controlling the stress and the force that goes across that muscle, that tendon, or that bone. And there's really two ways to control that stress. One, of course, is weight, the amount of force that you're putting across a joint, the amount of force that you're carrying or weight that you're carrying gets multiplied as we stress the body. So that is a very controllable, can be controlled, difficult to control weight, of course, but can be controlled. And another thing is the actual strength itself. So if you're not used to doing something, like you and I, if we went out today to run a marathon, by about mile 12 or mile 13, something is going to break down. That is not something that our body is used to. Whereas people who have trained routinely can run for, some people run for 20, 30, 50 miles because they have trained for that. And so the training and the preparation, the conditioning, and being within a healthy weight are all important things to get you sort of in this zone where you can perform at a high level.
And then, Apamna, I think you mentioned about the upper and the lower type of injuries. So are the injuries always classified in those ways, like upper part, lower part of your body? Could you just tell us more about it?
Absolutely. So different injuries have different risk factors. For example, if we talk upper extremity, arms, shoulders, elbows, hands, certain factors increase your risk for that injury. Some are unavoidable, but some can be corrected. Typically, the way that the injury happens in the arm is usually caused by a fall. So if you fall, have the arm in a wrong way, if you get hit by a ball, like especially in the hands, cricketers, as you know, oftentimes have hand injuries if you catch the ball the wrong way, or if you're throwing. So a lot of bowlers, a lot of throwers, if you're doing a lot of overhead activities, that can increase your risk of overuse in that area. Certain sports, of course, can also increase the risk of upper extremity injuries. Tennis, for example, is a lot of overuse. Swimming, volleyball, and like I mentioned, bowling puts a lot of stress on the upper extremities. So that's one of the risk factors, particularly for arm injuries. Now, for leg injuries, it's slightly different. One of the risk factors, at least when we've looked at prevention studies, is actually level of competition. So in general, if someone was supposed to have a leg injury, because you're competing at a higher level when you're actually competing. So if you're in a game as opposed to in a practice, you're actually more likely to injure at the game than you are at practice, because your level of exertion, you get a little more aggressive. You might take slightly risky behavior that increases your potential for injury in the leg. Another one actually is a surface that you play on. Artificial turf, for example, is a debate in the sports medicine world that goes back and forth. Some artificial turfs are actually a little too sticky or too stiff. So when you plant your foot, now there's increased friction or increased force on your foot compared to the rest of your body. And so if your foot's not able to slide properly or give out the way it's supposed to, if there's too much force, that now can transfer force somewhere else, into your knee, into your ankle. And that could be where the force sort of breaks down, and then you end up with an injury. Fitness, of course, is yet another reason that we can have lower extremity issues. As people get tired, their muscle recruitments change. And as that happens, again, the forces start to change around a joint, around a muscle, around a tendon. And that can cause either an overuse injury, or if someone were to tackle you at that time and your muscles are not able to prevent overloading a joint, then you can have a joint injury. A lot of different factors that we keep in mind and control as best as we can.
Okay. I was playing cricket for quite some time, and I had twisted one of my legs. And that's the time when I came to know I had a ligament tear. That's called ACL, I'm sure.
Correct.
And my doctor, he advised me to stop playing cricket. And definitely, then I stopped going to the doctor. So I'm coming to my next question. Why I mentioned this is because one thing I understood that, when you go to a doctor, first, when he says you have to stop playing cricket, your emotional, I want to know what happens to an emotional status of a person when he gets injured, according to you. It's
a very good point. Emotions run high, as is just going to the doctor. I mean, getting the appointment, making time from your busy day. You don't know what your doctor's personality is going to be like. And I can't speak to many doctors' personalities. But yeah, I mean, you have some goal or something on the line that now you're not able to go to. So it's definitely an emotional thing. Similarly, there can be some external pressure sometimes as well, whether it just be your friends giving you a hard time. You used to buy, what's the problem today? For some people in a very competitive sport, their coaches, their teammates, and for younger kids, sometimes even their parents. These are external forces that can affect, and people's well-being definitely gets affected from an injury. That's why myself and many other sports medicine physicians, once someone has an injury, the goal is not to tell them to stop. That's the easy way out. If that was the case, it wouldn't take 15 years to train to do what we do. It was just like, okay, I'm not going to. That's not hard. Right. What makes this hard is, okay, Yuosuf Bhai tore his ACL, wants to get back to playing cricket. Now, how can we apply our training and our experience to the best of our ability to get you back? And as you've seen in football, cricket, soccer, American football, so many people do recover from injuries. Some people are able to recover at a level that they were at before. Some people are at least able to get back to play. And unfortunately, some injuries are career ending. A lot of it goes to the degree of the injury. But absolutely, there's a very emotional part to sports that we as surgeons and physicians need to do a better job of understanding. Because the sports itself is so good for someone's mental well-being, the camaraderie that you have with your friends, your teammates, the fellowship, and it builds a healthy lifestyle. It builds healthy habits, not just for you, but for people's sons and daughters as well, to see their parents continue to stay active. So very strong emotional aspect that should be looked at as well.
Okay, Dr. Saab, that takes me to my next question. The irony is that people play sports so that they stay fit and they live a healthy life. And what happens when they start playing sports and they get injured? So their regular life gets affected.
Great point. So if you go back to injury prevention, as you mentioned, we play sports to live a healthy life. So sportsmanship, teamwork, hard work, dedication, the discipline, and just the physical fitness are all the benefits of sports.
That's right.
And even when we play sports with other people, other teams, that sportsmanship and camaraderie should be emphasized over winning the game. Of course, in the josh of the game and the heat of competition, that's our focus and that's our goal. And of course, that's frankly why we're there. We're there to win. Sometimes, though, that can lead to aggressive behavior, risky behavior. Potentially, you're overtired, dehydrated, overworked, but you still just want to go for one more issue, or one more play. And that's sometimes where mechanics break down. You take a slide tackle you shouldn't, or someone else comes after you, and that's when an injury can happen. It can be a small injury, or it could be a leg fracture, and we don't know what it's going to be. So as Islami falsafa teaches us, as Mola teaches us, everything in moderation. We are a wasatni ummah, so even in sports, moderation. You don't want to overdo it, but you should participate and find that healthy middle ground that keeps you active, keeps you fit, but still keeps you healthy.
Dr. Saab, I have the next question. It says that usually the moment a sports person gets injured, and you must have seen that he starts rapidly, wazan ghano jaldi vadhwana shuru kiya jaye. Because obviously his regular activities stop down. He's stopped down working out, gymming. In that stage, how do you advise the sports person to tackle this issue?
It's a very good question. So weight itself is an independent risk factor for injury. Just as an example, when we exert ourselves with sports, more weight just on the arm itself, that extra weight, like if you gain weight in your arms, gets multiplied threefold across your shoulder, but really in the legs now. So now your weight of your upper body, your stomach, it goes into your legs. So going up and down stairs, the force across your knee gets multiplied sixfold with each step. So if you've gained 5 kilos for any reason, now going up and down steps, that's 30 additional kilos with each step that your body feels. And that gets multiplied across. And then similarly, as you start running, jumping, playing sports, that force gets multiplied across. And that's where some of this breakdown and injury can happen. Now, after the injury, your athletic level is decreased because you're not able to participate. So what can you do? If you start gaining weight during that aspect, which of course is easier said than done to prevent that, but if you start getting weight, that makes your training and your return to sport harder. As is, you haven't been using your muscles as much. You've now put some more weight and more force across it. So as you try to recover, you're having difficulty from both aspects, from what your muscles can actually do and how much your muscles have to do with the excess weight. So weight, there's really two things. And of course, any doctor you ever talk to in the world will tell you two things: diet and exercise. That's like, our MO. So if your exercise ability or capacity is decreased, then you have to adjust your diet. And that doesn't mean go into a flash diet or crash diet, but adjust your diet. Adjust your moderation, adjust your portions. Hamnabi in Nairobi Ashram Mola did a very beautiful bayan about eating to moderation. And those sorts of things is stopping when you're not when you're stuffed, but when you know that you're getting full, then you're like, okay,
Right.
this is good. So little things like portion control, and adjusting that as your activity level adjusts will be very important. Unfortunately, too, there's the emotional aspect of not being able to play, and that's where the cookies and the ice cream and those comfort foods tend to come out. So we have to be very cognizant of that as well. But it's definitely something that we have to be active about, both from a health standpoint and a fitness and sports return to sports standpoint.
I think half of the people, if just they take this advice, I don't think they need to do any workout.
It's so much easier said than done. But just as an example, the importance of fitness, right? So we're seeing a very healthy revolution among mu'mineen towards a fitness focused lifestyle. And it's, alhamdulillah, it's an amazing thing. I mean, just looking at Bar Umur, having Sehat as one of the Umurs, shows the importance of our health and fitness. Having an international organization like Burhani Sports that's really thriving along multiple aspects, brings people together and competes at a very high level. Unfortunately, in the last year and a half, we've seen the importance of health. One small virus has upended the entire world. Our daily life, people's businesses, our ability to travel has just been completely changed by one small particle. And so that's the importance that sports and health has. And so seeing this focus throughout Mu'mineen and Mu'minat is absolutely fantastic. And seeing also a weight-based focus as well. Ensuring our weights are in control, ensuring what we can do to stay healthy, not just short term when we're young, but long term into our late years, inshallah.